When it comes to Medicare and Medicaid, President Trump has some big changes in the works. Whether you're a senior relying on Medicare or someone who depends on Medicaid, these changes could directly affect your healthcare. Here's the breakdown. 1. Medicare, more money for private plans. If you have Medicare, you may already know that there are two main parts: the traditional Medicare plan and the growing Medicare Advantage plans, which are private insurance plans that work with Medicare. Trump is pushing for $25 billion more funding for these private Medicare Advantage plans, which will help companies like Humana and United Health. This move is meant to keep the private plans competitive and improve options for seniors. But it's also sparking debates about whether the government is investing enough in the traditional Medicare program. A big shift could be coming, with predictions that nearly 2/3 of Medicare users might end up in these private plans by 2033. 2. Medicaid, cuts, changes, and a big debate. Medicaid is a lifeline for millions of low-income Americans, and Trump's budget proposal is raising a lot of concerns about its future. The administration wants to cut Medicaid funding over the next decade by $2 trillion. This could mean fewer resources for states and, potentially, stricter eligibility rules, like requiring people to work in order to get Medicaid benefits. Critics argue that these cuts could hurt vulnerable populations, including children, seniors, and people with disabilities. There are also fears that local hospitals and health services could be stretched thin, especially in rural areas where Medicaid is often a primary source of care. 3. What's changing? Some of the proposed changes include tougher rules on who qualifies for Medicaid, making it harder for people to stay on the program for long periods of time, requiring people to prove their employment status to qualify for benefits. Trump's administration is also looking to privatize more parts of Medicaid, pushing more people into managed care programs. This could change how Medicaid is delivered, making it harder to get care for some people. 4. Will benefits stay the same? Here's the thing: Trump has repeatedly promised not to cut benefits for Medicare or Medicaid. But the proposed cuts to funding, along with changes in how services are delivered, might result in delays or fewer services for some people. For example, fewer staff and more paperwork could mean longer wait times and frustration for those relying on the system. 5. Why it matters to you. If you're on Medicare, you may soon have more options for private plans, but that could also mean fewer resources for traditional Medicare. If you rely on Medicaid, the proposed cuts and stricter eligibility rules might make it harder to access care. Many are concerned that these changes will hurt the people who need these programs the most, including the elderly, disabled, and low-income families. In summary, President Trump's plans for Medicare and Medicaid are complex. While he's pushing for more funding for private plans and promising no cuts to benefits, the changes to Medicaid could make it harder for some people to get the care they need. As these debates continue, it's important to stay informed, especially if you or your family depend on these vital programs.